A ban on non-essential travel between France and the United Kingdom has come into effect. The new restrictions, announced by France on Thursday, with just a week to go till Christmas, set off a last-minute rush. Long lines in London as people queued for hours for the Eurostar train to Paris. And in Dover, hundreds of cars were backed up at the ferry, hoping to beat the midnight deadline. The French government imposed the curbs to help slow the spread of the Omicron variant. The UK has seen a spike in coronavirus infections with more than 93,000 new cases on Friday.
Santa Claus is coming to town. Or maybe not, if it's Paris he's going to and his last stop was London. Non-essential travel between France and Britain grinds to a halt on Saturday as strict new rules go into force. At Paris's Gare du Nord, Christmas holiday makers were grabbing their last chance to get to London on the Eurostar on Friday.
I feel very lucky that I managed to get out of France on the last day that it's possible. But yeah, it is a bit worrying. It's a bit scary. Who knows what's going to happen in January when everything gets back to normal after the new year. So we'll see.
I think it's a bit late, really, considering Omicron's already here as well, and it's obviously in Britain, so I don't see why, considering people come from here from France, why we need the restrictions.
We're fans of escape games, so we thought this is a grand adventure.
We were looking for an escape game, and we found it.
Exactly how to get out of France and back from London. They'll make it out, but re-entering France from Britain won't be quite as jolly. Across the Channel, there were long queues at London's St Pancras station as people there sought to travel in the opposite direction and get to France while they could. From Saturday, even if the British can convince French authorities that their travel is essential, they'll be subject to self-isolation on arrival.
Talking about a travel ban from the UK to France, we earlier asked DW correspondent Charlotte Chelson-Pale if this was causing concern in the UK.
Well, those that did have plans to go to France, clearly very, very disappointed. We're hearing that they've been either rushing to cancel or, as I say, rushing to get across the border. There have been noises from tourism bodies as well. They've described this as a hammer blow. Obviously, they've been very, very badly affected by the pandemic over the last year and a half. So another blow to them. But a lot of people in the UK, I have to say, are really focused on the domestic situation. France has said that it's imposed these restrictions because of the rapid spread of Omicron in the UK. It says it wants a chance to increase its booster jabs there. But the situation in the UK really is quite alarming at the moment. The number of cases has been rising for 3 days running. And I think it's those case numbers that France is looking at here.
Let's now go to Brussels and speak to DW correspondent Bernd Riegert. Bernd, countries across Europe are tightening restrictions and are now reintroducing travel restrictions. France and Austria have both reimposed them. Are more countries likely to follow suit?
We are already looking at a patchwork of regulations, additional requirements and rules. Portugal, Ireland, Italy, all of them have established already additional testing requirements. France is now banning essential travel from the UK, although, for example, you can enter a train from the UK to Belgium. That's still possible, though there's also not very logical, all these restrictions. And Austria is now taking the lead because Austria is only letting people in who are boosted. You can only get there if you have 3 shots. If you are only vaccinated, you need an additional test, and all other people have to quarantine. And the Netherlands are contemplating a full lockdown again, and also a travel ban. And Germany also is considering now some areas in Europe as high-risk areas, so you cannot go back without quarantine. And in the next days and weeks, we will see more countries fall into this pattern. So we are back to the scheme we had last Christmas, and everybody wanted to avoid that, but the new Omicron variant is forcing governments to react.
Now, clearly restrictions differ from country to country. Could there be a unified European approach?
Well, bluntly speaking, there is no European approach. There was a summit just last Thursday here where the leaders had the dire warnings on the table, but they ignored them. The ECDC, the European Centre for Disease Control, the EU's own agency for this purpose, said you cannot stop Omicron anymore. It's too late. Even booster shots and vaccination will not stop this fifth or sixth wave in Europe. You have to consider actually to set up makeshift hospitals to take care of all these hundreds of thousands and millions of cases that are coming, not as a wave, but as a tsunami. And the leaders, well, they did nothing. They went home and did then their own restrictions, but no coordinated effort. They care about their domestic situation. The only thing that they agreed on, they want to stop travel restrictions for lorry drivers, for example, so that delivery chains at least function over the borders.
Okay. Regarding vaccinations, you mentioned earlier, how well equipped is Europe for yet another wave?
The EU Commission here in Brussels tells us there is enough vaccines, there are enough shots for everybody. The Commission is buying them for all of Europe and distributing them. There might be some shortages in the first quarter of the year, but this is still can be still worked on with the manufacturers. But the problem is that the ECDC, the control agency, says there's not enough time anymore to prevent the new wave by vaccinations or boosters.
Bernd Riegert in Brussels, thank you. Across the continent, governments are introducing restrictions such as limiting opening times for restaurants, pubs and venues. Vaccinating children is another measure authorities are taking to reduce the severity of infections.
A quick pinch and it's all done. These kids in Denmark are getting vaccinated against COVID-19.
I got the jab because of the new corona variant, and I don't want to be so sick that I can't eat dinner.
Omicron is spreading at a fast speed in Denmark. Infection rates are hitting daily record highs, pushing more and more parents to get their children jabbed. To slow the spread of the virus, the Danish government has announced that cinemas, theatres and concert halls will be closed. Restaurant opening hours will also be restricted. In neighbouring Germany, the health minister has raised the alarm.
I'm assuming a massive fifth wave. We have to prepare ourselves for a challenge that we have not yet faced in this form.
Infection rates have been rising rapidly across Germany too. The easy spread of Omicron would send rates soaring even higher. As a result, the German government has now classified Denmark and other countries, including France and Norway, as high-risk areas. Travellers will have to quarantine for 10 days upon arrival, unless they have been vaccinated or recovered from a coronavirus infection.
Kai Kupferschmidt is a journalist and molecular biologist. He joins us from right here in Berlin. Hello, Kai. So, are travel bans and restrictions really justified?
Well, I think we have to look at these two things separately. There's a lot of uncertainty still about what exactly the impact of Omicron will be. Well, what we do know is that it spreads really, really fast and that it is going to lead to a lot of infections. So that's the reason that, for instance, in a country like Germany, where we still have a high number of unimmunized people, we need to be really careful, and that's the reason that restrictions are being put in place. And that seems to be the right call at the moment. When it comes to travel restrictions, it is much more complicated. We do know that this virus is basically everywhere at this point. And, all you can do with travel restrictions really is slow down the spread of the virus to your country a little bit, and a little bit it's spread within the country. But I think we're probably past that point. So I think that we should really be concentrating on what we can do within our own borders to prepare for this wave.
Okay, so let me ask you a question that is on many people's minds. Basically, does Omicron affect the vaccinated and unvaccinated in the same way?
again, you have to be really careful and look at different scenarios here. Most of the data we have at the moment is for people who've been vaccinated either with AstraZeneca or with Pfizer or Moderna vaccines. And what we see there is that the protection from symptomatic infection, so from a mild disease, let's say, is very, very low if you've had 2 shots of AstraZeneca. It's quite low if you've had 2 shots of Pfizer. And if you've got a booster, it is much, much higher. But the most important thing, of course, at this point is the question, what happens with severe disease? And the data there, for the moment, I mean, we're still getting a clearer picture, but I'm quite hopeful that the protection from severe disease, if you're vaccinated and boosted, is really high. And so there is a huge difference between people who've been vaccinated and boosted and people who are unvaccinated as we enter this new wave with this variant, which we're still trying to understand better.
Exactly. Quick one before you go. So what really needs to be done to prevent new variants appearing every couple of months? How can we break that cycle?
Well, it's a complicated question because the biggest thing we can do to reduce variants emerging, of course, is to reduce the number of infections worldwide. As long as this virus replicates in hundreds of millions of people, you're always going to see a lot of mutations, and then you have natural selection acting on this. And in the end, you might get variants that evade immunity or have other, have advantages when it comes to transmissibility. So That's one thing that we can do right now. The hope, of course, is that with new vaccines, we might be able to avoid infections and especially severe disease better. And in that case, at some point, maybe we can treat this virus as a lot of other coronaviruses that we are infected with every year. That's the hope.
Okay, journalist and molecular biologist Kai Kofferschmidt, thank you.